My name is Maddie Hollandoni, and I'm a student at Emory College, and I'm sitting here today with Mr. Jay Friedman, it is March 31st, 2008, and we are in the CDC. So welcome. Thank you for coming.
Thank you for having me.
And just to get started, if you could tell us a little bit about your background, your hometown, where you've come from, your education.
I was born in New York City at 123rd Street and grew up in the borough of Queens. Went to college at Florida State University and then joined the Peace Corps, where I spent 2 years in Sierra Leone, West Africa. Following the Peace Corps, I went to graduate school at American University in Washington, D.C. I studied international economics and languages. Towards the end of my 2-year course, I was reading a notice in the Return Peace Corps Volunteer Bulletin, which asked for ex-volunteers who had lived in West Africa, who could speak French, which I could, and who knew how to fix a car, which I also could, having worked my way through college as an auto mechanic and an automobile dealer in New York. Well, the notice was from the Centers for Disease Control, asking for people with those qualifications to go back to West Africa and work on a smallpox eradication program. And it seemed like that fit me perfectly. So I made a phone call to the number in the notice and spoke to a person called Leo Morris, who was the deputy branch chief or deputy director of the program, who happened to be coming to Washington the very next day, where we met, and he hired me on the spot, which I'm certain is no longer possible at CDC to hire anyone so, shall we say, unknowingly or without knowing all that much about him. Today there's all kinds of background and security checks. Anyway, it worked out well. Following later that year, which was 1966, on July 1st, I reported here in Atlanta and went to work for the Smallpox Eradication Program, whose director at the time was Donald Henderson, Dr. Donald Henderson, D.A. Henderson, whose deputy, of course, was Leo Morris, aforementioned. Dr. Henderson, not long afterwards, left to head up the smallpox program at the World Health Organization in Geneva. Meanwhile, I joined roughly 40 other people newly hired, some of whom had been CDC employees, others like me were not, to go through I forget how many months exactly, about 3 or 4 month training course in epidemiology, about which I knew nothing, about the characteristics of smallpox, which I also knew nothing about. We also learned quite a bit about the culture and the politics, if you like, of West Africa, which I knew a bit more about. We also were sent, we were divided into two. We were medical officers and what were called operations officers. I was an operations officer. And the operations officers were also sent to the Chrysler Corporation Service Training School. It was somewhere in South Atlanta, I think on Moreland Avenue, I forget exactly. And we went through a course learning how to work on Dodge pickup trucks with which we were going to be equipped in West Africa. The medical officers studied more epidemiology than we did. Anyway, following a couple of months of this, those of us going to French-speaking countries, of which I was one, I was assigned to the Republic of Mali, stayed behind, I think, and went through a very intensive French language course. I knew a lot of French, but obviously I didn't know everything, and learned a lot of this course, which was run by Emory University. Then in December of '66, I and the medical officer I was working with in Mali, Dr. Pascal Imperato, left for Mali, and we started working on eradicating smallpox. Mali was a difficult country. Among the, I think it was 20 countries we were working in West and Central Africa, because in the early 60s, a leftist government took over from the French colonists, the French colonial power, rather. And they were very close to the Soviet Union and North Korea and all the communist countries at the time. So the fact that this program was financed by the United States, specifically the U.S. Agency for International Development, meant it wasn't easy for us to work at first. But Dr. Imperato and I, if you like, made friends with all the principal characters we had to work with. And gradually we gained their confidence, and we didn't have any further problems. Initially, in West Africa, the approach was called mass vaccination. Smallpox being what it is, I won't go into detail, but the reservoir is human beings. There's no animal or water or other insect-borne way of transmitting the disease. It's human to human, and the vaccine works. So the idea was that if we had we vaccinated a certain proportion of the population, which the doctors in charge of the program thought would be about 80%, we'd stop the transmission of human-to-human smallpox. Mali was very difficult because through the country runs the Niger River. It's called, in French, the buckle of the Niger River, the bend of the Niger River, which creates a large swampy area in which live nomadic cattle herders. And these people move with the rising and the falling of the river depending on the rainy season, the various seasons, rainy, dry, and cold, are the 3 seasons of the year there. And Dr. Imperato, fortunately, was an amateur anthropologist, which I believe was one of the reasons why he was selected to work in Mali. He studied the movement of these people quite thoroughly and actually wrote some scientific papers on it and figured out where vaccinators should be at certain times of the year, etc. So we began vaccinating in this area, which is right in the middle of Mali. Very difficult to access. We had to use boats and other means of transport. At the same time, besides mass vaccinating, our other task was to look for smallpox cases. This was done by having or alerting local health workers all over the country to alert the Ministry of Health in Bamako, the capital, if they found or noticed smallpox cases. And we had an agreement that if smallpox cases were found, we would go out there and investigate. We, being trained, of course, in recognizing smallpox and knowing how it transmitted, et cetera, et cetera. So, meanwhile, there were cases of smallpox in the country, in Mali. And we investigated several outbreaks, I remember. And we kept vaccinating at the same time. Meanwhile, one of the medical officers in the program, Dr. William Fagey, who later became director of CDC, in eastern Nigeria had come up with another methodology for attacking smallpox, and that was called surveillance containment. I believe, Dr. Sencer can correct me if I'm wrong, he felt that you really couldn't vaccinate enough people purely to stop the transmission, given the various problems with nomadic populations and that sort of thing. The best approach would be just to look for cases and put vaccination on the back burner, if you like, and contain every outbreak with various strategies, one of which was ring vaccination, containment. That is, you vaccinate the people right around each outbreak and check everyone coming in and out of the outbreak area with people called watch guards. And sooner or later, you'd interrupt the transmission, and even if there were unvaccinated people, the fact that you interrupt the transmission since it's only transmitted from human to human, that eventually you'd stop the transmission of smallpox. And in fact, this is the way smallpox was eradicated. So I spent 2 years in Mali. I was there till September of 1968. Then I was transferred to Gabon in French, or the ex-French Equatorial Africa. It's around the bends of the armpit of Africa, if you like. Very rich country on the north-south coast. It's an oil producer and all sorts of minerals. And it's in a part of Africa that's very underpopulated for various reasons. I don't know, there's issues with fertility and venereal disease, that sort of thing. So the population there was very low. And smallpox is a disease that requires a certain density of population to transmit. And there hadn't been cases in Gabon for a long time. The reason we were there, working there, was that it was surrounded by countries that did have smallpox. So anyway, I spent about a year, almost 2 years in Gabon. And didn't have a lot to do, actually. We concentrated on vaccinating them because there were no cases. And Gabon, being a wealthy country, had a mobile health service called, it's in French, I'll translate it, it was called the Endemic Disease Service, set up by the French military, whereby health workers would be transported from village to village on trucks, and they'd treat people for various illnesses and also do 5 vaccinations at once, look for leprosy and sleeping sickness and other diseases. Anyway, I was an advisor to this endemic disease service for smallpox eradication. And I forgot to mention, in all these West African countries, we were also doing measles control. And this was also in Mali, I forgot to mention. The West Africans were not so much interested in smallpox eradication, which was a public health problem, but not, in their eyes, a major one. It was a major one in our eyes as Americans or Westerners because it did have worldwide implications. But in West Africa, they had many greater problems, among which was measles, which, unlike the United States and developed countries where it's a benign childhood illness, or somewhat benign, in West Africa, where children's immunity or immune systems are a little weak because of malaria and other diseases they have. Am I on the right track, Dr. Sencer?
You're doing
Correct
fine.
me epidemiologically.
Except let's move along a little bit so we can get to India.
Okay, all right. Anyway, we also gave measles vaccinations. Right. I was in Gabon for 2 years, and then I was sent to northern Nigeria, to the city of Kano, where I also spent 2 years. There was no smallpox in Kano either. In April of '72, I received a telegram from Dr. D.A. Henderson, who I mentioned earlier. He knew I was due to go back to Atlanta for CDC. There was a limit on the amount of time you could stay overseas. He asked me if I'd be willing to resign from CDC and go to work for the World Health Organization and go to Nepal, where they needed an operations officer like myself. And I did. I resigned from CDC, came back to went home to New York for 2 weeks, and then I was on a plane for Geneva, where I went through an orientation course for just a couple of weeks, and then arrived in Kathmandu, Nepal, in the end of April 1972. Nepal, of course, is in the part of the Indian subcontinent where there was lots and lots of smallpox, much more than in West Africa. Population's denser. Those countries are somewhat less well organized than West Africa, and vaccination levels were low. They had constant endemic smallpox, which kind of moved around the Indian subcontinent in a big circle. And the year I arrived, in 1972, the endemic areas were much further south in India. So we're nowhere near Nepal, which is on the northern border of India. At the end of 1973, the big circle of track of smallpox moved up to northeastern India, very close to Nepal, and we were immediately inundated with lots of cases. we had adopted the surveillance containment approach. And I became very busy investigating outbreaks. I had as colleagues there another operations officer and a medical officer. All the cases in smallpox, practically, every case, was the result of cross-border travel from India to Nepal. That border is open like the US-Canadian border. People just walk back and forth. In some places you can't tell which country you're in even. And we had lots of cases, first in the western part of Nepal, which was at the time in the 70s very underdeveloped. No roads at all from the capital there. You had to drive through India or fly in a plane. There were even places where there were airports, but no roads. So the only modern means of conveyance the local population had ever seen were airplanes or aircraft and helicopters. They'd never seen a car or a truck. You had lots of anomalies like that there. So this is 1973. I spent a lot of time trekking in western Nepal looking for smallpox cases. At one point, and I wrote this up, which is part of the smallpox archive somewhere, I was flown to an airport in western Nepal where there was no road, and walked a couple of days to an outbreak area along with my Nepali colleagues. There were about 5 of us. We found that the local smallpox people had contained the outbreak. They had done all this ring vaccination I mentioned. And we spent a day or so there and realized there was nothing more for us to do. So decided to visit other neighboring districts and just look for cases. There had been no reports. So I was with a doctor named Benu Bahadur Karki, who was the deputy smallpox chief in Nepal. And we started walking, and after a day or so, he branched off to one district and I to another. I walked and walked for several days and got to the next district where there were American missionaries living. I spent several days with them and ate steak and mashed potatoes and stuff like that, which you couldn't get elsewhere in Nepal. There were no smallpox reports from this area. I then walked several days down to the plains of Nepal, which border India, a very flat area, unlike the mountains in the rest of the country. And spent several days there also looking for smallpox, along with the local smallpox staff. Found nothing. Then the town I was in, right on the border with India, had a once-a-week plane service back to Kathmandu. So I bought a ticket, and the plane never came. And it only came, as I said, once a week. I didn't know what to do. I was stuck in this place. There was no road back to Kathmandu, and I had no car with which to get home. So I was hanging around the airport. There was a very wealthy Nepali. He belonged to the upper crust of society, who was there with a Land Rover. And he was also trying to get on a plane. He had been hunting elephants or something. And I started chatting with him, and he said, well, I'm going to drive to Lucknow, a big city in India, several hundred miles south of where we were. And I'm going to fly home from there, and you're welcome to come with me, which I did, and arrived home a couple of days later. I had been gone 2 weeks and essentially had fun and really didn't do anything. So the World Health Organization, well, I had done something. I had done some surveillance, but not anything concrete. The World Health Organization then got money for helicopter charters, which were very expensive. It was $400 an hour to run a helicopter. For the next, this was in 73, I was in Nepal till 77. For the next 4 years, we used helicopters to go to these remote areas where we could do what I did in 2 weeks in a day and just go and come the same day. And since we had so much smallpox, the circle now moved a little differently in India, such that now eastern Nepal was full of smallpox. And a third operations officer came, a guy named David Bassett, who also had worked for CDC. And so we were 4 people actually working there and inundated with cases all the time. So 1974 was the worst year in Nepal. It was also the worst year in India, as I remember. The state of Bihar in India, which borders on eastern Nepal, was loaded with smallpox all throughout 74 into 1975, such that I'm trying to remember the dates now. In November 74, I was asked to stop working in Nepal, where we had things more or less under control, and spend 3 months in India, along with many other people. At the time, the Indian government couldn't scare up enough people to work on smallpox. The problem there was so enormous, tens of thousands of cases, that they not only hired young medical guys who just gotten out of medical school, I guess, who had been studying public health, and none doctors, people like me, we were called technical officers, but also from CDC and WHO brought in people to work on smallpox for 3-month periods. Some of these were ex-West African people who had done what I'd done. Others, some of them I think knew nothing about smallpox at all. On the other hand, the epidemiology of smallpox is such that you can teach any intelligent person in 15 minutes everything he has to know. As I said, it's human to human. It's no other reservoir. In a day, you can make anyone truly, without too much exaggeration, an expert on smallpox. So CDC sent a lot of people. WHO recruited others in Europe, along with our Indian colleagues. We were an army, can't tell you, but my job in Bihar state in India was to be in charge of paying everyone. They wanted a full-time WHO employee in charge of the money, and I guess I was one of the few. So I was in charge of paying hundreds of people, both Indian and non-Indian, in Bihar state, for which they gave me a suite in a very run-down hotel in the capital of Bihar, which was Patna. This was just a low-down, grungy Indian hotel, but it had a suite. And since I was in charge of all the money, I had a safe. They gave me this suite, which I lived in luxury, essentially. But I was very busy. We had an office there with a number of people. Dr. Larry Brilliant was in charge of the office. And believe it or not, I was busy full-time paying people. All these people in the field had to have money because the Indian government rules and regulations were so Byzantine. For example, if you had an official Jeep and it got a flat tire, you had to fill out forms and get some senior person somewhere to approve spending $1 to fix it flat. So WHO got a system going whereby everyone had an impressed fund, they call it. What it meant was you had $100 in your pocket to freely spend as you saw fit to fix flat tires and grease the skid, so to speak. So I was in charge of replenishing all this money. There were some bizarre scenes with all the money. Everything was in cash. Once a month, I'd get a large check from the WHO headquarters in New Delhi for $100,000 or something like this. I can't remember. It was lots and lots of money. And I take it to a local bank there in Patna and deposit it. Then every day, I had to go back to the bank and withdraw enormous amounts of cash. It was in rupees. I can't remember, but say $10,000 every day, something like that. And I carry this in my briefcase, all this cash. Indian banks being what they are, it took sometimes 3 hours from the time I walked in the bank and said, I want this cash, for them to count it. They'd have guys sitting on the floor counting it. And I'm exaggerating, 5 or 7 people to sign out on this money. And they give it to me wrapped in, money's wrapped in pieces of paper. And I'd stuff it all into my briefcase and then walk out on the street holding it, unguarded. Anyone could have walked behind me and whacked me on the head and run away with it, but nothing ever happened. Anyway, I go back to the office and spend the day passing out money to people who come in to get it. I kept very detailed account books. At the end of every month, they sent an accountant down from New Delhi to go through my cash, my checkbook, and there was always some discrepancy of, $1 or something like this, and I could never figure this out. The night before this auditor came, I'd be up all night going through the books trying to find out why there was a $1 discrepancy. This guy was an Indian. He spent 5 minutes. He goes, zip, zip, let's go through the books, and there's your $1. After I had been up till 3 in the morning trying to get it all straight for him. Anyway, I did this for 3 months, handling the money. Then I went back to Nepal, where we still had some cases. We had the very last cases. This was in early 1975, February 75, which was complicated by the fact that the king of Nepal, the new king, had his coronation that very month, and you couldn't travel anywhere. Meanwhile, we knew there was smallpox in certain places. To make a long story short, some of these cases spread indigenously in Nepal, which hadn't happened before, because nobody could go anywhere. The country was more or less locked down for the duration. Anyway, in March and April of '74, in this southeastern corner of Nepal, we had our last cases, which were very well documented. Many photographs of the last 3 cases. It was a husband and wife and a child. In April '75, we had our last case and sent a telegram to WHO headquarters in Geneva. I remember it. The telegram read, D.A. Henderson, World Health, Geneva, no pox. And the signature was Nepal Smallpox Eradication Program. They still have it on file somewhere, I guess. I stayed there another 2 years. The task of the last 2 years was to look for non-existent cases. They had their last case in Nepal, I believe, the following month in May, and in Bangladesh, that August, I think. Anyway, India, Bangladesh, Nepal, we spent the next 2 years until '77 looking for smallpox. We had armies of people out doing surveillance. I think in India, I read at some point they had 100,000 people do surveillance for a week or 2 weeks.
More than that?
More than 100,000. Anyway, there was lots of people working on this. We looked for 2 years. Didn't find a case. There were lots of reports because we were offering rewards at this point. We were offering initially a reward of 100 rupees, which at the time was $10 or something. And then the reward was up to 1,000 rupees, which is $100. Anyone who reported a case that turned out to be smallpox would get a small fortune by the standards of India and Nepal and Bangladesh. And we got lots and lots of reports, many of which turned out to be other skin rashes, including chickenpox, scabies. I don't know what some of the others were, but we were all trained in doing this differential diagnosis, and so was everybody else. All the workers at the lowest level all knew about this. In fact, they eventually knew more about it than we, the foreign advisors, which was a nice thing about smallpox. Nobody really knew more than anyone else. Everybody knew everything there was to know about smallpox. I remember my job during this period in Nepal was being a foreigner. I could do things and go places around the bureaucracy in such a way that my Nepali colleagues running the smallpox program couldn't. For example, I knew the Minister of Health when he was a young junior doctor, when I had arrived 5 years before. Literally, I could go to his office, knock on his door, wearing a T-shirt and jeans and sandals, and walk in, and he'd greet me warmly. No Nepali official could do that. That was the anomaly of being a foreigner in a country like that. One of them. Anyway, at the end of the 2-year period, WHO constituted committees for each country. Dr. Sencer was on the one for India, as I remember, who'd come to the country. These were usually very senior virologists and epidemiologists from various parts of the world. The committee that came to Nepal was headed by the Polish Minister of Health. His name was Jan Kostrewski, excuse me. And there were other people. I remember there was a Japanese scientist who was a virologist, various others. I don't remember everyone. But I had to take these people around the country looking at the work we were doing. And at the end of, they were there for 2 weeks in Nepal. They certified smallpox in Nepal as being eradicated. And this coincided with Nepali New Year, as I remember. The Nepal calendar is April to April. So they made this certification. They left. And then the head of WHO in Nepal and myself were invited for an audience with the king of Nepal, which doesn't sound like much, but it was very rare for a foreigner to meet this guy, which I did. I have a photograph of it. Unfortunately, he was the king of Nepal, assassinated year 2000, I think. He was a young guy. Spoke beautiful English. And, I'd seen his picture everywhere for 2 years, but I'd never seen him in the flesh. It was very funny. The WHO representative, Ray Mills, and I were leaving, and we both said to each other, he's a nice guy. I wouldn't mind drinking a beer with him or something. Yeah. Anyway, a couple of months later, I left Nepal, my work having finished. I was then transferred by WHO to the Philippines, where I worked for a year. You were Filipino? Hey. Lived in Pasay City. Traveled all over the Philippines for the expanded program on immunizations, childhood vaccinations, somewhat related to smallpox. It's quite different in many ways, though. A lot of the work I had to do regarded smallpox vaccine production. There's a big lab there, not smallpox, excuse me. Vaccine production, no more smallpox. This was diphtheria, pertussis, tetanus, other childhood diseases. The lab knew nothing about how many doses they had to produce. So a lot of my work was figuring this out based on my experience with traveling around the country, as well as getting reports from hospitals and doctors all over the place. I first learned to use a computer there. I also traveled a lot in the Philippines. Saw the country. It was the only country I was in where outside the capital was nicer than being in the capital. Manila is a huge tropical city full of traffic. Not very pleasant, but all the secondary towns and cities there are very nice. I like that. Anyway, I spent a year and a half there. And then I came back to CDC. Went to work in the Division of Reproductive Health, working on first what were called contraceptive prevalence surveys, looking at women of reproductive age in a population, usually 15 to 44, sometimes 49, and looking at the proportion using contraceptive methods, which one, and most importantly, of those not using a contraceptive method, why they weren't. I did that for a number of years. Then I did something slightly different, which was contraceptive logistics. AID Washington, the State Department, as part of foreign aid, distributes contraceptives all over the world. I worked with a group of people here at CDC, and it was very similar to what I was doing in the Philippines, figuring out how many contraceptive methods each country needed, which ones, and when they should be delivered and all that. Next, since I had worked a long time on on contraceptive prevalence surveys, excuse me, I'm getting mixed up. I, along with two other people in the Division of Reproductive Health, since we were so-called experts on surveys, got some money from the Indian Health Service to do behavioral risk factor surveys on Native American reservations in the United States. This was looking at smoking and drinking and car accidents and other stuff that Native Americans are prone to a point. In doing this, I traveled all over the United States, went to some areas I'd never, ever get to, Idaho and northern Maine and lots of places where Indians live, which sometimes you don't realize they're there. We even did a survey in New York City where there were 35,000 Native Americans. I, having grown up in New York, had no idea these people were there. And towards the end of my career, we're now in the 2000s, I started working again on maternal health surveys, including contraceptive prevalence, mostly in southern Africa and Jamaica. I worked on 4 surveys in Jamaica, in the Caribbean, and 1 enormous survey in Zimbabwe, in southern Africa, and then retired in January 2003, 5 years ago. Here I am. I'm having a good time being retired.
What was the most important thing that your experience in smallpox taught you?
Well, that's easy. Achieving smallpox eradication in Nepal, where I had spent 5 years. It was the only country I came to call home, being there so long, and I liked it the best. And I was married by this time, and we had 2 kids who spent their first years of their lives there. And it was quite an achievement. It was much more difficult than West Africa for lots of reasons, among which was that people didn't accept vaccination as readily as the West Africans. There was a lot of epidemiology, which I learned pretty well. A lot of logistical problems. So it was very satisfying eradicating smallpox in Nepal. It was in West Africa also, but quite frankly, it was a lot easier in West Africa, in my opinion. That was the most rewarding thing, I think.
One final question, Jay. What did you bring out of Nepal?
Personally, I learned a lot. I learned to speak a little bit of Nepali. My wife and kids learned it fluently. I think I brought out mostly an ability to, I'm going to put it in very metaphorical terms, speak to the Nepalis. By that I mean, I learned their rhythms and I got into their rhythms, so I knew when to a point, insist on something, when to not insist on something, when to hold back, when to be a little more assertive. A lot of this I learned from my boss, who was a guy named Dr. M. initial Satyanathan, who was Sri Lankan. He was in charge of smallpox there as far as the WHO people were concerned, and he taught me a lot of that, being an Asian himself. He knew when to go along with what the Nepalis wanted to do, and at the same time when not to. And I picked up what I learned from him. And I guess that's an oxymoron, what I just said. And I think this carried over to my later career, where I was working on the surveys here, back in Atlanta, back at CDC, many of which were in foreign countries. I did a lot of work, as I mentioned, Jamaica and Zimbabwe, also in Senegal and other West African countries. I even went back to Nepal a couple of times as an advisor, as a, what do you call those guys? A foreign technical advisor, excuse me, in family planning and reproductive health. And I think I was much better at doing this than when I was a young guy in my 20s and 30s, starting out, when I, as an American, didn't really empathize with foreign cultures. Not foreign, I mean, I was used to England and France, other countries, but dealing with people in Asia and Africa is very different from dealing with a European or an American, especially different from being an American. And I think I got pretty good at that.
Great. Well, thank you.
Did you bring anything material out of Nepal?
Well, my younger daughter is an adopted Nepali orphan. She's now 35 years old and married, but I guess you could call her a material thing. I also, I'm kidding, of course. I think she'd laugh at this. I also, you mean possessions? I bought an antique car in Nepal, which I brought back here to Atlanta, which I drive around in still.
How antique?
It's a 1932 Ford, which had belonged to a Nepali general, who gave it to his daughter, who gave it to her driver, from whom I bought it. And I had it restored there and shipped back home in a big crate.
How'd you get it out of Nepal?
A local moving company, who was the agent of Allied Van Lines here in the States, made a big crate. This is before containers, 1975. Big crate, as long as this area here. And I drove the car into the crate, and they tied it down with chains and ropes and everything. And it had hooks on the top. And a crane, we hired a crane, or they hired a crane, and lifted it up and went onto a truck. The truck drove the crate to Calcutta in India, near a seaport. It was loaded on a ship, of course. Ship landed in Los Angeles, and it was loaded on another truck and came here to Atlanta. I drove it out of the crate, same crate.
The mythology is that you brought it out on an elephant, but you didn't.
No, well, I would have liked to. Well, I'll tell you, if you want to hear this too. The car was brought to Nepal in 1932 before there were roads to Kathmandu from anywhere. There were roads in Kathmandu. It's in an enclosed valley. The car was made in Canada, shipped through India to the Nepal-India border, where the railway ended. It was put onto a bamboo platform, the car. The bamboo platform had handles at the end, pieces of bamboo sticking out. I can't tell you how many, but 30 porters carried this bamboo platform with the car on top over the foothills of the Himalayas to Kathmandu. If you don't believe me, there are pictures in National Geographics of the 30s and 40s showing porters carrying cars. There were lots of cars in Kathmandu carried in that way, including this one. Anyway, that's an aside.
With that, I think we'd better quit.
I think so.
Thank you very much, Jay.
You're welcome.
Thank you.